Hello everyone, I'm going to be sharing an experience now of what happened in my ward. To be precise, children emergency ward. A mother came into the hospital facility with a child complaining of difficulty. This child is unable to pass out urine for long. They've been moving from hospital and now they are being referred to the teaching hospital. So what is happening? Let's examine the child. On examination, we found out that the external genitalia of this 3-year-old child is nowhere to be found. No jokes, it has been removed totally. Now let's catheterize this patient so that this patient will be able to pass out urine. We could not find any place to pass that catheter into to get into the bladder. We as the nurses, we tried, the doctors were involved, they tried, but we could not actually catheterize this patient. Why? Because the mother actually carried out female genital mutilation on this child while she was young. And after much history taking, we found out that this child is having what? Acute renal failure. And if not treated on time, you know what it's going to result in. It's going to result in chronic renal failure. Good day everyone and welcome back to Nurses Lecturing YouTube channel. My name is Messi Mary, popularly known as a nurse with the difference, and I make learning easy and accessible for students. Today I'm going to be discussing with us female genital mutilation, the short-term effects, the long-term effects, and also ways we can prevent female genital mutilation from taking place in our community. By the end of this class, you being a nursing student, you being an onlooker, not necessarily a nursing student, you'll be able to know what to do in your neighboring community on how to prevent female genital mutilation. And also, I'm going to be discussing or sharing with us at the end some other traditional harmful practices that we in Africa, most especially, have to stop. But before we go into details, if you are new on our YouTube channel, kindly click on the subscribe button, turn on the notification button so you don't miss out on any of our video. Let's go there. Welcome back. Like I earlier said, today I'm going to be talking about female genital mutilation. It is not called female genital mutilation in our community. It is normally called circumcision. And you hear most parents saying, oh, I have to circumcise my female child. I have to circumcise my female child. She was going to be promiscuous. She's going to like sex. She's going to do this. So I have to circumcise it. So they generally know it as female circumcision. But in the recent, only the male child has to be circumcised. What then is female genital mutilation? Female genital mutilation can be defined as the removal of parts, that's some parts, or total external genitalia of a female, either for cultural reasons or non-therapeutic reasons. There is no therapeutic reasons or there is no medical importance while these genitalia are being removed. They are removed for cultural or therapeutic reasons. So when I hear female genital mutilation, what should come to your mind is that there is a removal. This removal could be some parts or a whole. That's a total removal of the female external genitalia. Do you know what I mean by external genitalia? I mean those things you are seeing on the screen right now. You can see the clitoris, you can see the labia majora, you can see the labia minora. In some villages, they remove the external the labia minora and the clitoris, some remove the clitoris. So we don't know what's happening. But in some, they do the parts or they do the whole. Remember, female genital mutilation is what it could be defined as a procedure that involves the parts or total removal of the external genitalia of the female for cultural or non-therapeutic reasons. That takes us to the effects of this female genital mutilation. What are the dangers? Why should you not do it? So the first one I have here on the board is severe pain. You will agree with me that female genital mutilation is not carried out in the hospital. And most TBA, most women that carry these things out in the villages, I mean, they don't know what's anesthesia. They don't even give local anesthesia. They just take their normal razor blade, their sharps, and start cutting. And this female child is in severe pain. So one of the effects of what FGM is what severe pain. Then the other is excessive bleeding. You see children bleeding. I was in a community health center during my community posting. A child was rushed into the community health center for what? This child was bleeding as a result of what? Female genital mutilation. So if not properly done, which is not advisable at all, it can lead to excessive bleeding, which is hemorrhage. So excessive bleeding is one of the immediate effects of what? Of FGM. And that excessive bleeding can lead to shock. For the nurses, you know what hypovolemia is? There's reduced fluid in the body. And if hypovolemia is not handled, it can lead to what? Hypovolemic shock. And if hypovolemic shock is not handled, it can lead to death. So take note of that. Shock. Then we have genital tissue swelling. Most times after this female circumcision, they so call it, you see this child having genital swelling. The outside part, the external genitalia, they are all swollen. It takes time to heal. So many things are going on, and this person is in pain. Then the other is infection. Our little babies are dying of infection because of female genital mutilation. Most of the instruments used for this process, they are not sterilized, I mean. So they just go ahead, they can decide to use one razor blade for 10 people because they lack the necessary knowledge needed to carry out such a procedure. So infection is one of the immediate effect of FGM. Then we have urination problem. Like I earlier said, a child was brought into my ward and that child has difficulty with micturition. Why? Because there's problem with the external genitalia as a result of what? As a result of FGM. Because it was not properly done, it was not properly carried out, or something happened on the way. Then the other is impaired wound healing. Sometimes after this whole process, the wound will not heal properly. It can be as a result of infection. The wound will not heal properly, it will take time, and finally when the wound heals, it will bring out one funny scars and all those things. So impaired wound healing is one of the immediate effects of FGM. Then mental health problem. A child can actually pass through severe mental health problem as a result of this experience, this severe pain passed through by this child at a tender age. The child becomes aggressive. Yeah, I've seen a child like that, becomes aggressive. The pain was just too much and was like, oh, why would my parents do something like that to me? That child developed this kind of hatred for the parents, more or less like a post-traumatic stress disorder, I would call it. So it can actually affect the mental health of a child. So I encourage mothers not to do it. Then the other is death. Remember, like I said, after the whole pain, there can be what? Excessive bleeding. That excessive bleeding can lead to shock, and shock can lead to what? Death. So these are the immediate effects of what? Female genital mutilation, popularly known as female circumcision. Then the other I want to discuss are the long-term effects. Sometimes these children may pass through this phase. They might be okay, after much treatment they will be fine and start functioning in the society. But there are long-term effects associated with FGM. And the first I have here is chronic pain. Chronic pain as a result of damage to some nerves. That their nerves around that particular areas have been affected. And this child continuously experiences pain all the days of her life. Why will a mother do that? Let's stop being self-centered as parents. Then the other is infection. Infection, like I earlier said, this child now has kidney problem. And if that acute kidney problem is not tackled on time, it can lead to chronic kidney probe issues. And not just infections of the kidney, it can also lead to infections of the internal female reproductive organs if care is not taken. Then the other I have is painful urination as a result of alteration of that external genitalia. You see some of them, anytime I want to pass out urine, I'm always feeling severe pain. Nurse, I don't know what's happening. I'm always feeling pain. Those pain can be as a result of what? FGM. Then the other vaginal problem, you see them having vaginal problems all over. Then menstrual problem can also fall in. Excessive scar tissues around that area. This patient start having scar. this child start having scar at a tender age while growing up, even at the age of 16 when it was done 2 years, the scar is still there. It reminds the child of the bad experience. Then childbirth complications can also be one of the long-term effects of this female genital mutilation. Giving birth becomes difficult, and during the process of giving birth you start seeing different problems arising during the course of labor, during the course of pregnancy, even puerperal, even affecting the baby in the course of delivery. Then we have infertility, and we all know that PID, pelvic inflammatory diseases, can result in infertility. So when it results in infertility, this child will not be able to give birth, and we start blaming what? We start blaming the witches in our villages, we start blaming a lot of things around us, we start blaming these. The infertility can be as a result of these menstrual problems or vaginal problem, as the case may be. Then the other is sexual health problem. That is, you remember most parents do that because they tell you they don't want their child to be promiscuous. So in such a situation, when that female child grows up, the child normally experiences pain during sexual activities. This child no longer, there's no pleasure with sex. The child is just having sex with a spouse because it is important to give birth. There's no sexual stimulation, there's no pleasure, there's no sensation there, because the clitoris actually derives that sensation during sexual intercourse. It's been chopped off. So you see this person having, oh, it's sex time again. It gets tired with sex, especially when having sex with the spouse, and that can lead to husband looking outside if care is not taken. So why will a mother want to do that? So with these few points of mine, I hope I've been able to convince upcoming mothers. I hope I've been able to convince you not to even try it at all, because you are not only how would I put it now, you are not only hurting this child now, you're going to be hurting the child in the future. So protect your girl child, teach them sex education, but don't carry out female genital mutilation, because when she grow up, she will want to enjoy the fact that sex is sweet and not painful. So you pass through that as a mother does not mean your daughter is going to pass through that. Take note, I am saying, and I'm still saying, no to female genital mutilation. So the other thing I'm going to be talking about is, how do we stop this? The fact is, there's a popular saying, our people perish for lack of knowledge. So regular and proper education is very, very important. We should educate our people, the villages, the community, on the effects of female genital mutilation. The televisions, the media should be involved in educating the people on the effects of female genital mutilation. And also, healthcare practitioners should also be involved when it comes to the prevention of female genital mutilation. Then also, I would like to share with us other harmful cultural practices that our society involve ourselves in. The first I have here is early marriage, especially in the north, where you see children getting married at the age of 12, at the age of 13, at the age of 14. That is really bad. Early marriage should be stopped. That is one of the harmful practices that we are saying no to. Then another is harmful nutritional practices / food taboos. Like, for example, in a community, they will tell you it's a taboo for you to eat snake, it's a taboo for you to eat beef, it's a taboo for you to eat pork. Those harmful nutritional practices should be cut short. Then the other is maltreatment of widow. When a man dies, they say it's the wife that killed the man. That we should not, how do they say it? They'll say they have to barb the woman's hair, the woman have to dance in the market. That is also a harmful traditional practice that we ought to stop. Then another is male child preference. What now? What did we, the female child, do? Is it bad? Is it a bad thing that we came out? Is it a bad thing that our mother gave us birth to us as female? So that male child preference should also be a no-go area that should be stopped. Girl child maltreatment. You see, oh, the girl child don't have to go to school. The girl child has to stay at home. The girl child is supposed to take care of her husband. That is actually a harmful practice that's not going to affect us now, but it's going to affect our future. So we advise our girl child to go into school. Then another is abrupt weaning of in child. You see, after 1 month, the mother tell you, I'm not breastfeeding this child again. Let the child start eating pap. Let the child start eating the food we are eating. It makes them strong. It makes them agile. They can give you reasons why you should do what you're not supposed to do. So let us be careful. Then also, child abuse. Child abuse is a harmful practice that has to be stopped. Then I think forced feeding. God, have you seen an African woman? No jokes, I've seen it. He or she will open the child's mouth and start forcing the pap into the child's mouth. That is a harmful practice that we have to stop, because if care is not taken, it can totally stop that child from breathing. If there is aspirations, it goes into the respiratory system and respiratory tract. That's going to be very bad for the child. So that should be stopped. Then wife inheritance, bam. I think it's normally done. Let me not just call the particular state that do that. They'll tell you when a man gets married, the man dies, the man's younger brother takes over. Imagine, why now? So wife inheritance is also a harmful traditional practice that has to be stopped. So alongside with the female genital mutilation and the harmful traditional practice that has to be stopped, the next thing I would like us to talk about is where we can stop this harmful practice, ways we can stop female genital mutilation. And the first one I want to tell you is health education, because our people perish for lack of knowledge. We have to educate the public through the media. We have to educate the public through the TVs, through the radio station. Whatsoever means it will take us to health educate the communities, we should go there. For the villages that don't have access to internet and media, I think we should go through the kings, the queen. We should involve them. We should tell them they are killing their people if they are not aware of the dangers of female genital mutilation. That will go a long way to actually help curtail that. Health education. Let's educate the people so they know what and what not to do. Then also, healthcare practitioners should be educated on ways to prevent further complications from these dangers that are being done to our female child. Thank you very much for staying tuned. Thank you very much for watching our video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. Before I go, if you are a nursing student and you are not part of our Telegram classes, I would lie to you. You have been missing a lot. We have a lot of voice notes for all the systems: cardiovascular, respiratory, digestive, all the systems, even research, management, community health. We have voice notes all prepared for your wonderful learning. So if you are not part of that Telegram class as a nursing student, sincerely, you are missing. All you have to do to get involved is send a message to the WhatsApp number showing on your screen. You can also check on us on our social media handle: Facebook Nurses Lecture Room, Instagram Nurses Lecture Room, and on YouTube you are watching us from Nurses Lecture Room. Bye, and see you in our next video.